Our next guest is a clinical psychologist at Simon Fraser University that has focused his life around an academically rigorous approach to homelessness, mental illness, and addictions. He is a strong critic of our current approach, and many are beginning to look at his ideas as the way forward. We are grateful he has taken the time to be here tonight and that he is advising our think tank. Please welcome Professor Julian Somers.
Thank you, Sam and Lynn, for the invitation to join this wonderful tradition, and thanks all of you for making discussion possible and the chance for all of us to change our minds together. BC has the highest prevalence of both suicide and drug poisonings in Canada, and together these are referred to as deaths of despair. I'm going to summarize evidence, very high-quality evidence, that describes the transformation from despair to wellness. Deaths are the proverbial tip of an iceberg. Less visible is the proportion of BC's prison population that had been diagnosed with addictions, mental illnesses, or very often both, prior to incarceration, which rose from 50% to over 70% in less than a decade. Over the same period, involuntary hospitalizations for addictions and mental illnesses separately more than doubled in BC. And in the past year alone, deaths among people experiencing homelessness increased 75%, primarily due to addiction. Here is a disembodied list of characteristics of people that my colleagues and I have worked with intimately over the last 30 years in our work addressing and responding to people who experience homelessness, addiction, and mental illness. The numbers say more about the abysmal performance of our public service than they do about the people affected. The list also fails to reflect the pervasiveness of abuse and neglect among the people described, and the absence of supportive caregivers, usually throughout their lives. Over 25% were in foster care. Not that all foster care is bad. I'm an adopted guy myself with 3 sets of parents. 25% had children under the age of 18 when we met them. Their major goals included resuming paid work, overcoming their addictions, and reconnecting with children or other family members. The failure of the war on drugs teaches us that addiction cannot be affected by disrupting the supply of drugs. Instead, we need to address the conditions that create demand for drugs, which include unemployment, homelessness, and lack of meaning in life. Randomized trials conducted in Vancouver and internationally demonstrate the effectiveness of structured interventions known as recovery-oriented housing, sometimes referred to as housing first, that promote choice and social reintegration among people deemed the hardest to house. Results in Vancouver from randomized trials showed a 71% reduction in crime and a 50% reduction in medical emergencies in the first year of our intervention. By contrast, rates of crime and medical emergencies among people randomized to receive housing and support all together in a single building were no different, or were not significantly different, than the rates among people who remained homeless. Our clients credited their neighbors with their renewed sense of feeling normal. Their sense of dignity and value increased as they experienced being responsible for their own choices rather than having decisions made for them. Recovering wellness should be expected, and when it doesn't occur, the fault lies with the approach we're using, not with the people we're trying to help. The Stanford Lancet Commission recently analyzed the crisis of poisonings in Canada and the US. The very policies they singled out for skepticism trying to create an alternative pharmaceutical supply of drugs, installing vending machines to dispense drugs and paraphernalia, happen to be at the top of BC's current agenda. And the beneficiaries are people connected to the current government, former public officials who now own drug companies, and those running large SROs with the highest concentrations of death. Requiring the public to fund addictive drugs in neighborhoods around BC while ignoring the causes of addiction is recklessly dangerous and demonstrates the current government either doesn't get it, doesn't care, or both. When government leaders were advised that BC has one of the world's best information systems for measuring the performance of interventions addressing homelessness, crime, despair, and mental illness, they responded within a week by ordering SFU to destroy the database. Provincial audits reveal the absence of basic business practices associated with public spending on housing and other services for people living in perpetual crisis. When professionals such as BC public servants, physicians, lawyers, nurses, or airline pilots develop addictions, they are offered highly effective, recovery-oriented treatment. But when people who are impoverished develop addictions, they are provided exclusively with drugs and none of the resources that promote wellness and recovery. The government claims that poisonings disproportionately involve construction workers when fully 2/3 of people who experience poisonings in BC were not only unemployed in the year of their poisoning, most in the previous 4 years, according to T4 Income. The government also claims that legalizing drug possession will cause the decriminalization of drug users, but out of 70,000 offenses among British Columbians diagnosed with opioid dependence, drug possession accounted for only 3.8%. Most offenses involved theft associated with survival, and about 10% were associated with violence due to the chaos they're forced to live in. We can only decriminalize drug users by preventing those forms of crime. Here is one attempt to stimulate positive change in BC, developed over 18 months with a network of collaborators. Our recommendations are based on results of randomized trials that cost Canadians $120 million to conduct and learn from. We combined that evidence with evidence of where the needs for the same service are greatest in the province. I warmly encourage each of you to review our proposal and the associated 3-year budget. The proposal was submitted to David Eby last year to resounding silence. I believe improvement will require a new government, one committed to providing everyone with equal access to wellness, with clearly articulated plans based on evidence. We must insist on better. Dramatic improvements are needed and are achievable, and by working together, all of us will be elevated, most of all those currently living in despair. Thank you.